and Dr. Ryan Westergaard, Chief Medical Officer in the DHS Bureau of Communicable Diseases. And we'll begin today's briefing with remarks from Secretary-Designee Karen Timberlake.
Good afternoon, everyone. Thank you for joining us. And I'd like to start today's briefing with an update on the status of COVID-19 in Wisconsin, including an update on our vaccination efforts. As of today, over 6.2 million doses of the COVID-19 vaccine have been administered across our state since we began our vaccination efforts just last December. And that means that more than 3,093,777 Wisconsinites have completed their vaccine series, or about 53% of our state's overall population. With that being said, though, we are also reporting an additional 2,723 new cases of COVID-19 today, which brings our total confirmed cases of COVID-19 to more than 707,000 since the pandemic began. Our 7-day average of new cases also stands at 2,857, and that's nearly double where we were 2 weeks ago, and it's 123% higher than where we were a month ago. Today, we are also reporting that 19 more Wisconsinites have died from COVID-19, which brings our total deaths to 7,854. And our thoughts continue to be with family members and friends of those who have lost someone to this disease. We know that our hospitals and our hospital systems across the state are feeling the strain of this increase in disease activity. Across our state today, only about 5% of beds in our intensive care units are available, and 5% of medical surgical beds are available. And reports of pressures on staffing and staff availability are coming in from hospitals and long-term care providers all across Wisconsin. This surge in cases, this increase in hospitalizations, the pressures that we're describing today are all due to the highly contagious Delta variant that we've been talking about and combating for weeks now. And that's why it's really important that we increase the urgency of our focus on what we know works to protect all of us against the Delta variant. And that's especially important as we think about the back to school season that we are in, as we are seeing Wisconsin kids return to schools all across our state. Confirmed cases among children under 18 are continuing to grow, especially among kids 9 to 13, most of whom are too young to be vaccinated against this disease. What we need to remember is that kids live in families and families live in communities. When kids get sick from COVID-19, they can spread it to others like family members and friends and relatives who may not be vaccinated, even if the kids themselves don't have symptoms or don't become terribly sick. Some children who have had COVID-19 do later develop a rare but serious condition called multisystem inflammatory syndrome. And we want to prevent all of those new cases of COVID. We want to make sure that we can have our kids safely in school, keep our teachers and our staff safe, and keep those family members and those community members safe from COVID. The good news is that we know how to do this. We know how to keep kids in school safe, and the way we can accomplish it is by working together. We have to use all of the tools in our toolbox to combat COVID-19, to combat the Delta variant, as layers of protection against this disease. And these layers of protection and these tools must be used consistently and universally. This means that for kids who can get vaccinated, children ages 12 and older, we need to make sure that we're getting our kids vaccinated, and it's also critical that everyone who is working with kids, especially younger kids who are not eligible to be vaccinated, get vaccinated themselves as soon as possible. We want to make sure that masks are worn consistently by students, teachers, childcare workers, school staff, and visitors, regardless of vaccination status, because we do have so much variation right now in the vaccination rates for kids in particular, and because we have so many younger children who cannot be vaccinated, it is critical that the adults in their lives do everything they can to protect those kids, and it's critical that we set up safe environments for those kids to learn so that they can participate in school and in daycare and preschool settings to the greatest extent possible. We know that testing continues to be very important. Our department has been working with hundreds of schools all across our state to offer testing for our K-12 schools to make sure that schools have an early detection system and know when they have positive cases and can take appropriate steps. We also know that it's important for all of us to be following the guidance of the CDC, of our local health officials, of our school officials, to quarantine kids, teachers, and staff who may test positive for COVID, and that unvaccinated close contacts quarantine as well. And finally, we know that when students and staff, just like any of us in the workplace, are experiencing symptoms of COVID-19, we need to keep kids home. We need to keep ourselves home when we are not feeling well enough to come to work, or when teachers and staff are not feeling well enough to be in the classroom. All of these strategies taken together are what it takes to keep our schools operating safely, to keep our workplaces operating safely, and to stem the tide of this pandemic. So again, it's worth emphasizing one last time, COVID-19 vaccines are safe, they are effective, they are available to everyone across our state ages 12 and up. Wearing masks in public places is very important, and together, working together to keep one another safe, we will protect ourselves, our communities, and we will all move forward and out of this pandemic together. And finally, before we open things up for your questions on this first day of fall, it's important to remind ourselves that with fall arriving, now is a great time to go out and get your flu shot. The flu was not a factor last year, as many of us saw, because we had so much mask wearing and we had so much physical distancing going on. Now that we're all working to return to work and school and as many of our activities as we possibly can, it's going to be extra important this year to get your flu shot. So we'll have more to say about that, and we welcome your questions. Thank you very much.
And thank you. And a reminder to maintain audio quality. Please keep your phones on mute until it is time to ask your question. If you're able to do so, please use *6 to mute and unmute your phone. And we'll begin with Scott Bowler from the Associated Press. Scott?
Hi, thanks for doing this call. I know in California there are some signs that maybe the Delta variant is peaking or has peaked and maybe on the decline. Some reports of that elsewhere. Is there any sign of that in Wisconsin? What are the trends showing you? Is there any forecast you've got for the next month, 2 months? Thanks.
Great, thanks, Scott. I'm happy to start with that question, and we can certainly share some additional data, and I'll be happy to pass it off to Dr. Westergaard as well. I heard those same reports. I think what we'd have to say, looking at the trend lines on our new positive cases, is we are not at a plateau yet. We are not at a leveling off. We are still seeing a concerning rate of growth. And so I think the thing to maybe take heart in the reports that we are seeing from places around the country is that where we are seeing the beginnings, perhaps, of a leveling off, that tells us that that is what is ahead of us. The challenge that I would offer all of us is the fastest way to get to that plateau and eventually a downward trend in new cases is to follow the steps that we know work, to get vaccinated, to wear masks, to maintain physical distancing, to stay home when we feel sick. But Dr. Westergaard, anything you would add on the data trends themselves?
Yeah, to frame this, this issue, pardon me, I've spent a lot of time looking at epidemic curves around the world that have experienced a first large wave of COVID-19, had things improve, and then had the Delta wave. And that's clearly what's going on right now. Like in the early summer, we're feeling very good about our numbers, and then the Delta variant came in and really changed everything. Many countries around the world, after initially when their Delta surge happened, in some cases like India, it was quite a bit worse than the surge that they had in the first year of the epidemic. Right now, we're about half as bad as we were during our surge in November to January last year. And no one knows. We have not seen a turning of the corner. We've seen some states in the southern United States have the same pattern as India, where their Delta surge was more severe in terms of more cases per day and more deaths than they saw in 2020 in the winter. We wanted to do everything we can to not have that happen in Wisconsin, but we've not seen anything reassuring that we're not headed in that direction right now. What we've learned is that it does make a difference how we respond. And if we use the prevention strategy, if we maximize vaccination, we have the best chance of minimizing this surge. But where we are right now is on the uphill. When you look at curves, there's an uphill and there's a downhill. And right now, we haven't seen whether we're at the peak. So the message is we need to maximize what we're doing with prevention to get to the peak as soon as we can. Looking around the country, it seems to follow a south to north trajectory, and we're further north than the southern tier states. The Appalachian states had a really stark word, and we're probably next. So minimizing how large the surge gets is really up to us. We really like to see it turn the corner in the way that some of the California data do, but we're not seeing that sign yet.
Thank you. Now to Rob Sussman from WTAQ Radio in Green Bay. Rob?
Hi, yeah, thanks for taking my question. Given that according to the Milwaukee Medical Examiner, 60% of child suicides in Milwaukee last year were tied to COVID-19 isolation and virtual learning, while DHS numbers show that children under the age of 18 make up 0% of the state's COVID deaths. My question becomes, is there a point in which the cure for children here becomes worse than the disease for Wisconsin children, and how much is DHS keeping that into account when making these recommendations, especially given that kids between 12 and 17 now report the highest levels of anxiety, depression, and suicidal ideation of any age group in the state? Thank you very much.
Sure. I think the really critical point that underlies that question is that it's really important for all of us, and especially for our kids, that they be in school, that they be returning to activities that are as typical and normal as they can possibly be under all circumstances. And I think what's also important for us to think about is the risks that we have to different groups in our population, certainly from social isolation, as you described, and also from COVID-19. And so the question is really, how do we balance those risks and keep our kids safe while at the same time keeping adults and seniors in particular safe from COVID-19? The way to do that is to make sure that we have kids back in school, learning in person to the greatest extent possible, and adopting the prevention strategies that we know work. We need our kids and our teachers and our school staff to be wearing masks. That is the safest, easiest, simplest thing that can be done. And it's actually the only thing that can be done universally to protect kids of all ages from contracting COVID-19 and potentially spreading it to the vulnerable people in their lives. We also know that as we can continue to remove barriers, make it easier for kids to get vaccinated, we want to continue to do that. And we know that where we can minimize the need for quarantine by making sure that we've got kids wearing masks and getting vaccinated where they can, sitting safe distances apart, we absolutely agree that we need to do that. But at the end of the day, what we're seeing is COVID-19 is still making lots of people across our state sick every day. It's still killing people across our state every day. And so we need to balance what is in the best interest of our kids with what is in the best interest of the adults in their lives and in their communities.
Thank you. Now to Eric Gunn from Wisconsin Examiner. Eric?
Hi, yes, thank you for doing this. You pointed out the concern about more cases in children and that intersecting with schools being in person, and you certainly emphasize the needs, the steps that people need to be taking in terms of masking, vaccinations, staying home when sick, and just general awareness. Schools are not always following the guidelines that CDC and DHS promulgated back in the summer. And I'm wondering, are the state's hands tied at this point to take really any further direct action about this situation? Are you having to essentially rely simply on having to encourage this, but not being able to do anything beyond that?
So certainly it's the case that, you know, we do have some restrictions on state authority given the Supreme Court decisions of the last year or so. What's also true is that we have a lot of really hard work being done across our state with local school officials, with local public health leaders, with groups of parents and other community leaders who understand what it does take to operate schools safely. And so we are certainly there to provide additional education and awareness raising and updates on the science and making sure people have the tools that they need. At the end of the day, we are really relying on those local decision makers to make sure that they are adopting strategies that are going to work to keep kids and vulnerable adults in the community safe. We know what works, the tools are available, and we really do need people to pick up the tools in the toolbox and use them.
Thank you. Now to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thanks for holding this. Was just wondering, given the numbers that signed up for getting the first shot with the state vaccine incentive program, why not extend that further? Why end that Sunday rather than approving an additional extension like before? Thank you.
Right, so we were really pleased with the response to the vaccine incentive program. We had over 142,000 people get their first shot between the period of August 20th when we started the program through the extension and to the end of the program on September 19th. Part of what we were really sort of banking on and counting on is creating a sense of urgency for people by the sort of time-limited offer of that incentive. We did see that initial uptick in new first doses of the COVID vaccine. We also saw that start to trail off toward the end of the program. And so the initial extension, giving people a full month to get that first shot, now, you know, making sure everyone registers for their vaccine reward by the end of September, that seemed to be sort of as much effectiveness as we were likely to get from that initial incentive program. We're very pleased to see that there are additional, you know, municipalities and some private employers and others around the state who are kind of picking up the thread and are continuing to offer some of their own incentive programs. So I think together we're continuing to keep the focus on, we're continuing to make it easy for people to get that first shot, and certainly want to encourage everyone to continue to do that.
Thank you. Now to Alex Moe from wisbusiness.com. Alex?
Hi, thank you. Just wondering, given the recent significant spike in cases here in the state, is there any concern that the death rate from COVID-19 might see a similar increase as well in the coming days or weeks? Thank you.
we certainly know that the new cases themselves are the leading indicator, right? That's the first thing we see. That's followed by hospitalizations, and then that is unfortunately followed by an increase in deaths. It is certainly true that as we have more people contracting COVID-19, we should expect that we will see, as we are seeing, more hospitalizations, and we will see an increase in deaths. I think what's different today as compared to, say, September of last year is we now have large numbers of people vaccinated against COVID-19. And what we know is that the vaccines are extremely effective. All three of them are extremely effective against preventing severe disease, preventing hospitalization, and preventing death. And so, certainly welcome Dr. Westergaard to comment in just a second, but I think we should expect that while we will see an increase in deaths as we see an increase in cases, we will not see necessarily the same spike or the same sharp trend line in the rate of death as we are currently seeing in the rate of cases. But Dr. Westergaard, what would you add there?
I agree with that main take-home message that we have an incredibly potent tool to prevent deaths from COVID-19, which is vaccination, and that's been shown over and over again in very large studies. So that is the number one message. But to answer the question directly, it's generally always been the case that when cases go up, deaths go up. We've actually already seeing this. So at the beginning of August, our average deaths per day reported over the 7-day average was 1. Most recently, it is 11. So that's gone up more than 10 times. So we're already losing people to COVID-19 because of this current surge driven by the Delta variant. So the answer is we're already seeing it. Will we expect to see it get worse as cases continue to double week by week? Yes, and that's the very sad reality. People are going to continue to die from this disease until we get low levels of cases. And that's true even though that the risk of for vaccinated people is much lower, because it's so incredibly highly transmissible. Large numbers of cases in the community is going to continue to translate to hospitalizations and deaths until we get cases as low as we can.
Thank you, Alex. Now to Tajma Hall from NBC 15 in Madison. Tajma?
Thanks for taking my question. I'm wondering, as we continue to see increased disease activity, where do we stand with contact tracing? Right now, most of us
Excuse me, Tajma, it's
anymore.
very hard to hear you. Could you speak up, please?
Let me try to raise. Can you hear me now?
That's much better. Thank you.
Okay, I'll start over. So as we continue to see increased disease activity in the state, where do we stand with contact tracers in Wisconsin right now? Do we have enough? Most of us aren't social distancing anymore, so kids are back in school. How has that impacted the role of contact tracers in our state?
Sure. So contact tracing still remains very important because as we identify new positive cases, we want to make sure that we can be letting people know who may have had immediate contact with the person who has tested positive so that they can take the right steps for themselves, monitor themselves for symptoms, make sure that they're getting tested, make sure that they're making choices about the next activities that they're engaging in. We do continue to have contact tracers that we employ as part of the state's COVID response. They are really handling the overflow, if you will, from local and tribal health departments. At the end of the day, the primary responsibility for contact tracing remains with our local health officials. We also know that in the case of schools, we have some of our school districts that have the capacity to do their own contact tracing. Others are working in partnership with local public health to get contact tracing done. So the long and the short of it is that certainly as cases grow quickly, that does put a strain on the contact tracing system as it does other parts of the system as we've been talking about. With that said, it remains an important part of the strategy and it's something that we are certainly committed to.
Thank you. Now to Joshua Peguero from WBAY-TV in Green Bay. Joshua?
Hello. Thank you so much for taking my question and for hosting this media briefing. My question is, we just started the football season on Monday. The Packers at a home game. It was a full capacity the first time since January of 2020. There were people there that weren't wearing masks, even though they have taken certain, they ask people questions about whether they've been exposed with COVID. Is there any concern from DHS's take on COVID spreading at these large home games? Thank you.
So I think what you'll hear from both Dr. Westergaard and me is that we know what it takes to keep people safe at large gatherings. So it's worth talking about that since, as we know, not only football season is back, but we're seeing that, some concerts are returning and other things that may have been suspended in the last year or so. So outside, it's safer to be outside than it is inside. It's safest to be vaccinated if you're going to attend any kind of a large gathering or really any other activities in our state right now. If you're outside and can maintain some distance from people, that's great. If you're outside and, obviously in a more compact space like a seat at Lambeau Field, it's a good idea to wear a mask. And it's really important for all of the sponsors of these kinds of events to be promoting as much public health safety and good public health practices as they can. At the end of the day, we have been living with COVID for a year and a half now. We know what it takes to keep ourselves safe, and so there's kind of a shared responsibility here. We need to do what we can do to keep ourselves safe, and we appreciate the efforts of event sponsors and organizers to really be promoting vaccination, mask wearing, physical distancing, spacing of seats and that sort of thing where that is possible.
Thank you. Now to Rhonda Fox from WKOW-TV in Madison. Rhonda? Rhonda Fox from WKOW. Okay, moving on then to Shemaine Mills from Wisconsin Public Radio. Shemaine?
Hi, thanks. I'd like to follow up on Scott's question, if I may. Projections used by the CDC show Wisconsin has cases flattening or decreasing through mid-October. Do you have projections otherwise, or what specifically leads you not to believe the state is going to plateau in the coming weeks?
So happy to turn that one to Dr. Westergaard for additional thoughts, and then certainly we're happy to follow up if we need to, Shemaine, so thanks for that.
We don't have evidence to say that the cases will not plateau in the coming weeks. What I said is that we do not see evidence of a plateau in our day-to-day case counts. I think everyone can agree this pandemic is not going to last forever. This surge will not last forever. The cases will come back down. The things that we have control over, though, is how many cases. Any case we can prevent is going to accelerate the time when the curve plateaus and starts coming down. That's the message, is that it's not going to happen without hard work, turning the corner as quickly as we can. So our data right now show us to be on a steep uphill, and we've not seen a plateau. If that happens in the coming weeks, that would be wonderful. It's not a foregone conclusion. All models are guesses, and our message to our healthcare, public health, and general population is that we have control over what the curve looks like. And if we work hard and make smart choices about prevention, we can get to the place where we turn the corner faster.
Thank you. Now to Denise Lockwood from Racine County High.
Ma'am?
Denise?
Hi, I'm sorry. Hi, this is Rhonda Fox. I actually was having an issue with my phone.
Okay, go ahead, please.
Thank you. I'll make this really fast. Really quickly, our understanding is that many DHS staff who have been working remotely were required to return to the office yesterday. And we've heard from some people in the office building. They said now it's too crowded. Can you confirm which staff were required to return, how many people, and why the decision was made now?
Sure. So a couple ways to think about this. So all across state government, we have had thousands of people, including people who work for the Department of Health Services, who have been physically in the workplace throughout the duration of the pandemic. In the case of the Department of Health Services, we run seven facilities that operate 24 hours a day, 7 days a week, and we've had over 4,000 staff who have been working consistently in the facilities that entire time. With our partners at the Department of Administration, we have been part of bringing our office-based staff, if we can think of people like me in that regard, we've been bringing those office-based staff back to the office over a period of time, really beginning at the earlier part of the summer. And the next phase of that return to the office started this week as we had more parents whose children were back in school and had childcare arrangements set up, et cetera, kind of back with a steadier state of circumstances. So what we are doing to keep people safe in the workplace is the same thing we are asking any other employer to do. So we're asking people to wear masks in all state facilities. We are promoting vaccination, as you just saw. The governor has instituted both a reporting requirement for all of us to make sure that we are logging our vaccination status. That is now going to be followed by a testing requirement that people can be exempted out of if they are fully vaccinated. We have done quite a lot to increase the distance between people who don't have private offices by adjusting people's schedules, by making alternate work settings available to people. So at the end of the day, we know that it is possible to operate a workplace safely, even in the midst of a pandemic. It's possible to operate a school safely in the midst of a pandemic, and that is what we are doing, no different than what we know employers all across our state are doing as well.
Thank you. Now to Denise Lockwood from Racine County Eye. Denise?
Thanks for taking my call. So my question is around resources, and I was looking at the WHA website with regards to PPE. And the number of hospitals that are reporting that they have less than 7 days PPE. I wanted to find out how that is being addressed, and I also wanted to find out about staffing of these beds with regards to how we're doing in making sure that we've got people to care for people. Thanks.
Sure, happy to answer those questions at a high level, and certainly would welcome you to follow up directly with the Hospital Association, because I'm sure that they'll be able to add some additional detail. So earlier in the pandemic, we began doing the tracking and the public reporting of PPE on hand, because in the early weeks and months of the pandemic, as I'm sure you all remember, we did have some real shortages of masks and other supplies that hospital staff and other clinical staff needed to keep themselves safe as they were caring for patients. It is worth continuing to track that. We don't want to become complacent. What we learned through that process is that because of our sort of just-in-time supply chains that we've all become used to, it's actually fairly typical for hospitals to maintain a just enough supply of PPE on hand. We are in regular communication with the Hospital Association and with individual hospitals. We are not hearing today about any critical shortages of PPE, so I think that's the good news. We are certainly aware of pressures on hospital staffing, and that is also something that gets regularly reported that we're in regular dialogue about. Let's remember why we are having those staffing shortages and staffing pressures. We are having those pressures because we have been asking hospital staff, our nurses, our CNAs, our respiratory care therapists, our physicians, our environmental services and housekeeping staff to be working in really very challenging circumstances for 18 months. And so that is a set of challenges that we are actively working with the Hospital Association and with individual hospital partners I do want to loop back to a comment Dr. Westergaard made a minute ago, which is we all have a role to play in making sure that there is adequate hospital capacity. The thing we can all do to help our hospitals and our nurses and our care providers is to keep ourselves safe from COVID and not be that next patient that ends up needing a hospital bed, ends up needing intensive care services, ends up needing to put additional strain on our hospital system. So we have a direct role to play. There are steps we can take as individuals and as a broader community to help maintain the hospital capacity that we do have.
Thank you. Now to Rose Schmidt from CBS 58 in Milwaukee. Rose?
Hi, thank you for taking my question. I want to ask about booster shots. So the FDA panel last week recommended boosters for people 65 and older and high-risk people, and the CDC panel is talking about it today. I guess, what are your thoughts on boosters as a whole in this discussion that they're having? And when that final FDA authorization comes, what is the state's plan for boosters? You know, in other words, are you going to have mass booster sites or something similar to that? Thank you so much.
Yep, great question. So we're all certainly watching the work of the CDC Advisory Committee on Immunization Practices today and tomorrow, as you noted. That's going to give us that really essential guidance that we do need about exactly who that booster dose is recommended for. Once that is clear, we have been doing the planning right along. We have been working with our vaccinator partners. So again, that's our hospitals, our outpatient clinics, our pharmacies, local public health, even employer sites, to make sure that we've got people ready to go. I think the thing to remember, a couple things to remember. One is that as compared to when we began the overall effort to vaccinate the state of Wisconsin last December, we now have this broad network of providers of various kinds that are signed up and ready to go as vaccinators all across our state. And so that track has been laid, and we can continue to move the booster train, if you will, right down that same set of tracks. I think the other thing to keep in mind is that we are going to need to pay careful attention to who is in fact really recommended for that booster dose and make sure that we can prioritize those populations. So certainly, you know, thinking of our older adults, knowing that they have been the most vulnerable in terms of at greatest risk of COVID from the very beginning. We are already working with our skilled nursing facilities and with pharmacies to partner with assisted living facilities to make sure that those booster doses can be administered. And finally, I think as we move into this next phase of conversation and planning around booster doses, the thing we cannot take our eye off of is the fact that we still have thousands of people eligible today for their first COVID shot, and we want to make sure that we continue to prioritize getting that group of people, again, especially our kids, 12 and up, vaccinated and protected against COVID in the first instance. So we're going to have to do, as we have all along, we're going to have to do multiple things at the same time here. So do a good job rolling out the booster campaign and continue to really prioritize getting everybody that first dose of a COVID vaccine who hasn't yet had one.
Thank you. Now to wcushman from PBS Wisconsin. Will?
Hi there, thank you. I am wondering if Dr. Westergaard could talk a little bit about there's thousands of people in Wisconsin who are recovering from severe disease, being hospitalized, being on a ventilator, including a couple of kind of high-profile individuals who recently were taken off of ventilators and are recovering further at home or in other settings. I'm wondering if you could talk a little bit about what that recovery process typically looks like for people with severe disease, including people who were ventilated, and then what types of concerns about long-term health impacts they should be thinking about. Thank you.
Sure, thanks. I can talk about that briefly. In some ways, people who have severe COVID-19 have and recover, particularly those who've required mechanical ventilation, are going to need some rehabilitation and a good amount of time before they get back to their baseline health status. In many ways, this is no different than any severe lung injury caused by influenza or by a bacterial pneumonia. People who have severe lung injury and require ICU stay have a long recovery. They need to get their whole body back up to strength, and their cardiovascular system and their lungs need time to heal. So that's not necessarily unique to COVID-19, but we have learned some things that COVID-19 might do that are somewhat different than other infections, and you've probably heard about the post-acute or long COVID syndrome. And there are ways that possibly related to the immune system response to the infection that can cause symptoms that are nonspecific, that are fatigue and mental health system symptoms like what they call brain fog or depression or mood disorder that can linger for a longer period of time. And we're still learning about those things as we go. But this virus seems to have some unique characteristics that cause multiple systems to take a long time to recover. But the most severe cases, the people who spend some time in the ICU, it's not dramatically different than anyone who needs to be on a ventilator. It just takes a lot of time and a lot of recuperation, and many people need to go to a rehabilitation facility until they get their strength back.
Thank you. And a reminder, please keep your questions to one question so we can fit everybody in our allotted time. And we'll move on now to Sandra Tongren from Spectrum News. Sandra. Sandra from Spectrum News. Okay, moving on to Jonathan Nizer from NBC 26 in Green Bay. Jonathan.
Yes, thanks for the opportunity to ask a question. As was referenced earlier, there's pressure on healthcare staff availability, and we've also been hearing reports about people finding difficulty to get timely access to COVID testing. So is the healthcare worker shortage impacting COVID testing, and is there anything the state can do to address testing-related issues?
Right, thanks for that question. So I would say at a high level, those two things are not really related to each other. I think what folks are observing in terms of COVID testing availability is that, when in the early phases of the pandemic, when it was especially important to identify each new case and really understand the progression of the disease, we had a lot of community testing capability that was created. Over time, that has transitioned into testing that is widely available still at pharmacies, increasingly available through places of employment, available still in the healthcare setting, but that does tend to be more for symptomatic people who are currently patients of that particular healthcare provider. So, and now, of course, we have a widespread testing program that has rolled out in our K-12 schools, as I alluded to earlier. So I think the thing to think about for people who are interested in getting a COVID test, first thing to remember is that there are at-home tests that are available. The self-administered tests, those are available over the counter. There are tests available that can be ordered for at-home administration off of the Department of Health Services website. For PCR tests, that sort of gold standard of test, it does take a little bit of effort to find a place to get a test. But again, I would really encourage people to check the Department of Health Services website for those testing options. And I really want to underscore and give a shout out to the pharmacies all across the state of Wisconsin, both national pharmacies as well as local pharmacies. They have really been wonderful partners with us in COVID testing and vaccination. There continue to be appointment opportunities for testing and vaccination available at pharmacies pharmacies. And, so start with our website, but if that doesn't meet people's needs, absolutely check with pharmacies in your local area to get a COVID test.
Thank you. Now to Stephanie Haynes from TMJ4 in Milwaukee. Stephanie?
Hi there. Thanks so much. How is the state preparing for the potential rollout of Pfizer being available for kids 5 to 12? Thanks.
Sure. Yep. So again, the good news here, similar to our conversation around boosters, is we have relationships built already with vaccinators across our state. In the case of kids 5 to 11, where we would really want to begin and really strengthen that focus would obviously be in pediatric clinics and family practice settings, our federally qualified health centers, any kind of a primary care setting where we know kids are likely to be getting their well child care. In addition, so the sort of sequence of steps will be very similar to what it is today for adult vaccination, where providers need to be signed up with us as vaccinators. That gives them the ability then to order vaccine. We have the distribution channels all worked out. I think the other kind of communication and outreach opportunity will be through schools to make sure that kids 5 to 11 are in school or in certainly for the maybe 5-year-olds in some sort of an early school type setting. And so that's another great just avenue and channel for us to be making sure that parents and guardians and family members have all the information they need about the safety of the vaccine, the ways to access it, the importance of getting even younger children vaccinated. So I think all of those systems and processes are in place and ready to go, and we are very eager for that next phase of emergency use authorization for those younger kids.
Thank you. Now to David Wahlberg from the Wisconsin State Journal. David?
Hi, thank you. With cases highest among 18 and under and growing, I'm wondering if you can identify any patterns with cases in kids, whether they're exposure at schools, schools without mask requirements, in parts of the state with low vaccination rates. And also, given that the rate is higher among 14 to 17 than 9 to 13, why do you think that is, since the older group can be vaccinated?
Yep, thanks for those questions. So happy to dig in further and provide some follow-up on some of the trends, unless Dr. Westergaard has all of that information at his fingertips. The one thing I guess I would note is that it does, it does look like certainly the numbers of cases are higher in the 9 to 13-year-olds, although you are correct that the rate is higher in the 14 to 17-year-olds. So I think at the end of the day, what we know is that our rate of vaccination in kids continues to be less than we would like it to be. We've got about 40% of the 12 to 15-year-olds vaccinated, about 46% of the 16 and 17-year-olds fully vaccinated, and that's obviously where we need to continue to hone in. But Dr. Westergaard, I don't know if you have other thoughts on the additional questions that David asked.
Well, all of our trends and data are going to be caused by multiple factors. But if the answer is transmission in school playing a role, the answer is clearly yes. Compared to a year ago, this time, when we look at the number of schools that are reporting outbreaks in schools, we're more than twice as many outbreaks that have been identified, and it involves extracurricular type school sports activities. Like we're aware of all these things, and we're seeing them at a higher level than we were in the fall of 2020, even though the overall trend of the epidemic was really comparable. So that does seem to make a difference. But I think the bigger lesson is not to take away that it's solely the issue of schools that's driving transmission. We really have a generalized epidemic where transmission is occurring everywhere, and everywhere that people gather, we can lower the risk by doing these layered prevention strategies and the messages that we can and should. there's no reason that schools shouldn't be using all the layers and having universal masking in all schools. If we did that consistently, I think it's a very reasonable assumption that we would be seeing fewer outbreaks and fewer cases in schools. But that's not necessarily enough. We want people to know that all the layers, vaccination whenever possible, wearing masks indoors, having everybody wear masks as the norm, not leaving it to a personal decision when we're in those congregate settings indoor, particularly educational settings, is going to make a difference. So I think there's, everything is caused by a multitude of factors, but failing to do all that we know how to do to keep schools as safe as possible is playing a role.
Thank you. Now to Emily Haugen from WKBT-TV in La Crosse. Emily.
Hi. So La Crosse has their big Oktoberfest festival coming up in a week. What precautions would you or recommendations would you give to people who plan to attend, if at all, if you think they shouldn't at all? It's just so you know they're both indoor and outdoor activities.
Yep. So I think on events like that, it's really important to be vaccinated and to wear a mask when you're indoors. It's important to, my personal choice would be to avoid the kind of closest quarters and really packed in settings, especially since it's going to be impossible to know whether everybody around you has been vaccinated. It's going to be likely that not everyone will be wearing a mask. I think that the choice to attend or not to attend, if you're a person who hasn't yet been vaccinated, as you've heard national experts and our own experts here in Wisconsin say, people who haven't been vaccinated are extremely likely to come down with COVID because of the high transmissibility of the Delta variant. And it's a sort of roll of the dice at that point. Will you be a person who does pretty well with the illness, or will you be a person who gets really sick? So I think that making those individual choices to keep yourself safe, keep your family members safe, keep your community safe is really important.
Thank you. Now to Isaac Deinson from News 9 in Wausau. Isaac. Once again, Isaac from News 9 in Wausau. Okay, moving on then to Ben Wagner from WISN TV in Milwaukee. Ben?
Hi, everybody. Thank you for taking my call. I have a question about the Ryder Cup in town this week. Thousands of people from really all over the world are in Sheboygan County. In what way, if any, is the state involved in tracking cases potentially linked to that event? How would that be handled? And is there any concern of having an event that large, an international event here in Wisconsin while we're still in the midst of this pandemic? Thank you.
Yep, so the good news is that the Ryder Cup sponsors have put quite a number of good COVID protocols in place and have really promoted mask wearing, promoted vaccination, promoted safe practices. So we appreciate, again, everything event sponsors can do to be reminding people of the importance of keeping people safe. In terms of sort of paying attention to cases that come from an event like the Ryder Cup, I think what we would say generally is, that is important to do to understand how the disease continues to spread, but at the end of the day, that's looking in the rearview mirror. And what we really need to be doing is looking ahead at what we can be doing to prevent the next case of COVID-19 and keep the next person who attends the next gathering safe. And that's all the strategies that you've been hearing us emphasize.
Thank you. Now to Austin Montgomery from the Beloit Daily News. Austin.
Thank you for taking my call. Just wanted to ask specifically about the rise in hospitalizations. Is there also a breakthrough case risk? Has there been an increase in breakthrough cases along with that rise in hospitalizations? Thank you.
So happy to start with that at a high level and then happy to pass it off to Dr. Westergaard. What we know is that people who have not been vaccinated are becoming hospitalized at a rate that is 9 times higher than people who have been vaccinated against COVID-19. So there certainly are some people who have been fully vaccinated who may end up in the hospital with COVID-19. I will absolutely welcome Dr. Westergaard to comment on any other descriptors we can offer for that group, but the really core message is that you are much, much less likely to end up hospitalized with COVID-19 if you have been fully vaccinated.
I think there's a good way to visualize that on our website that our team and our Bureau of Communicable Diseases collaborated on, and the visualization is on the tab on our dhs.wisconsin.gov/COVID-19 website, and you find it's a tab called Illness After Vaccination. Exactly as Secretary Timberlake said, when cases go up globally, when transmission rates are high in every single county, we're going to see an increase in cases among people who've been previously vaccinated and people who have never been vaccinated. But the rate of infection, the risk of infection and hospitalization and death is dramatically higher among people who have not been fully vaccinated. And those numbers, this age-adjusted rates, which, as the Secretary mentioned, is 9 times higher among not fully vaccinated, are nicely visualized in the infographic that we have on our page. So I direct you to that for more context.
Thank you. And we have time for one more question, and that belongs to Eric Richards from WFRV in Green Bay. Eric?
Good afternoon to you. Thank you for taking my question. My question is regarding the COVID-19 vaccines, the unused vaccines. Given the numbers that you're currently reporting with the 53%, I think is what you said there, as far as the number of population that is currently fully vaccinated. What is happening with the unused vaccines? Obviously, they are discarded. Do you have any information on that? And is the state adjusting how many vaccines that they're requesting for everybody here?
Yep, sure. Great question. So big picture, the really good news is that there is plenty of vaccine supply available for all of our vaccinators in Wisconsin, and there continues to be good supply available across the country. That, as you all know, is a change and an improvement from where we were in the very early days, where we were ordering hundreds of thousands of doses per week and only able to get 70,000 just because of the early ramp up of the supply. It is also the case that we are now really focusing on no wasted opportunity to make sure that someone can get vaccinated against COVID-19. So we've done a lot of work with our healthcare partners around making sure that vaccine is more available in emergency departments, in urgent care settings, in primary care settings. Whenever a person is ready to get a COVID vaccination, we want that vaccine to be available and ready to match with that individual. What that is going to mean is that we are going to see more doses that go unused over time. The reason for that is just, again, because of the manufacturing of these vaccines. They come in multi-dose vials. They don't come in nice, tidy, individual, single-serving packages. And so we continue to monitor the doses that go unused, because that's important for us all to do as good stewards of this resource. But it's really important to remember that the most important thing right now is to get absolutely every person vaccinated against COVID-19. And so really the message is no wasted opportunity to give a vaccination.
Thank you.
Thank you. And that concludes today's briefing. Our thanks to DHS Secretary-Designate Karen Timberlake and Dr. Ryan Westergaard for participating, and to all of you for joining us. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Be safe and have a great afternoon.